Hi, may I come in?
Hi, yes.
Hi, I'm Sarah. I'm a student nurse practitioner here.
Hello.
Hi, are you familiar with nurse practitioners?
I am.
Okay, great. How would you like me to address you?
You can call me Joe.
Okay, Joe. What brings you here today?
Well, I've been having this problem going to the bathroom, just like this burning sensation, and then I've just been just not feeling well. I've had a fever, I've had chills. You know, I've got, I noticed when I went to the bathroom I had this discharge
Okay.
too, that came out, and so I thought, I better go to the doctor and get this all looked at.
Okay. Well, I'm glad you're here today. It sounds like you have some pretty serious symptoms, so thank you for sharing those with me. Tell me a little more about the pain. Can you describe the type of pain you're having and when you have it?
It's like a burning pain when I go to the bathroom, when I urinate.
Okay.
It burns, and then my back is so tender. It's just,
Okay.
just like a tenderness. This has been going on for like 5 days.
Okay. And what, pain anywhere else?
In my back and my stomach area, and when I go to the bathroom.
What is the worst pain out of all of those?
I would say probably that burning sensation.
Okay. Now, if you could rate that on a scale of 1 to 10, 10 being the worst pain of your life, what would you say that is?
Oh my gosh, an 8.
Okay. Now, is it constant, or does that burning come and go?
It just comes and goes.
Okay. And does anything make it better or worse?
Well, when I don't have to go to the bathroom, it eases up a little bit. But then my back aches and my stomach aches, so that's still there. That doesn't go away.
All right. Have you taken anything to make this pain better? Anything from medicines to hot or cold therapies?
No, I haven't really tried any of that. Maybe like an ice pack.
Okay. All right. And you mentioned the fever and the chills. What about the discharge? Can you tell me a little bit more about that? What's it look like? Does it have a certain smell or look to it?
It's kind of like cloudy and yellowy.
Okay. Okay. Otherwise, you've been pretty healthy?
Yeah, for the most part.
Okay. All right, so I gotta ask you some general questions. Any allergies to medicines?
No.
What about to anything in the environment?
No.
Foods, latex, penicillin? Okay. What about any medications that you take?
No, I don't take any medications.
Okay. What about anything from over-the-counter to vitamins to herbal remedies?
No.
Okay. What about past medical history? Any major illnesses? Such as diabetes, hypertension?
No.
Okay.
I don't have any of that.
What about any hospitalizations or surgeries?
No, I haven't been in the hospital.
All right. Do you have any history of sexually transmitted diseases?
No, I've never had that.
Okay. And then looking at your chart here, it looks like, based on your, just looking at your family history, because some diseases can have a genetic component, so we look at that. It looks like both your parents are still living, and then you have a sister, and they're all pretty healthy looking. Do you have anything else to add there?
No, I think that's about the same.
Okay. And then I like to ask some general social history questions. It helps me get a better overall picture of my patient. So tell me a little bit about your living situation.
Well, I live at home with my mom and my dad and my little sister. I live there. I used to go to work. However, I was just recently fired because, I've been calling off a little bit too much. So they didn't like that. I do go to college, like a local community college.
Great.
So I do go there.
All right, good. And then tell me, do you have any tobacco use now or in the past?
Well, I do smoke.
Okay. How much do you smoke?
About a pack a day. I've been smoking for the past 2 years.
Have you? Okay. What about any drugs such as marijuana?
Well, I do use some marijuana occasionally, but I don't think that's like a terrible drug.
Okay. Now, what about any alcohol now or in the past?
I drink, on the weekends, I'll drink like a 12-pack.
Okay.
Mm-hmm.
And any other drugs like cocaine,
Oh, no, nothing
heroin?
like that.
Okay, good. Are you sexually active?
I am.
Okay.
Mhm.
Do you have more than one partner?
I do. I've got a girlfriend that I've been dating for 2 years, so she's kind of, I'm active with her, but then also I've had a couple of other ladies and even a gentleman who I've been with.
Okay, well, I appreciate you sharing that with me because when you have more than one partner, it puts you at risk for sexually transmitted infections, okay? And so when was your last sexual encounter?
I would say a few days ago.
Okay.
Yeah.
And tell me more about the girlfriend you have. How's your relationship been?
Well, she recently told me that she was pregnant.
Oh, okay.
So that's kind of a little bit of an issue. And it's difficult, but, we're trying to work through that.
Okay.
Mhm.
All right. Well, all right. Yeah, that is a big issue at your age. But I mean, there are lots of things you can do, and I can help you and answer some more questions about that. But I'm gonna move on to just ask you some more about why you're here today and just some review of your system. So. If you have any, I'm going to ask you a bunch of questions, so bear with me, and if you have any concerns, let me know. So,
Okay.
do you have any, with this burning when you're urinating, are you having any vomiting or diarrhea or
No.
nausea?
Mm-mm.
Okay, what about constipation?
No.
What about any, you mentioned the fever and the chills, and the belly tenderness and the back tenderness, what about any blood in your urine?
No. Mm-mm.
What about any rashes or sores in your genital area?
No.
Okay.
Yeah, no, not that I've seen. Mm-mm.
Now, with your sexual activity, do you use protection?
Condoms occasionally.
Occasionally.
We don't use them all the time.
Okay.
Mm-hmm.
All right. I think we should then move on to your physical exam. And then if you think of any questions that, please share them with me while we're doing this, okay? So if you wouldn't mind having a seat up here.
Sure.
Let me wash my hands.
Mm-hmm.
So the medical assistant took your vitals, and you had a low grade temperature. Blood pressure looks good. Your BMI looks good. And we also did some other lab tests, and we looked at your urine and did some other swabs. So we can go over that after I'm done doing your physical exam, okay?
Okay.
So first I'm going to start with listening to your lung sounds. And typically we'd have all our patients in a gown and I would listen to your skin, but for today's purpose we don't have that.
Okay.
Okay, just nice breaths in and out. Alright, very good. Now I'm going to listen to your back here. Nice breaths in and out. Okay, good. I'm going to just, you let me know if you have any tenderness with this, okay?
Nope.
Okay. And anywhere when I'm touching back here, any of that hurt?
No.
Okay, good. Now I'm going to listen to your heart. Just nice breaths. You just breathe normal. Now listen with the other side of my stethoscope. Alright, good. And if you wouldn't mind, I'm going to just have you lay down and I'm going to look at your belly. I'm going to first listen, okay?
Okay.
Just kind of inspect it. And I'm going to feel around you. Let me know if you're having any discomfort when I'm doing this.
Okay.
Anything down here?
No.
Okay, and then what about when I do this?
No, not really.
Okay,
It's a little
look
tender.
here. Alright, good. And then for purposes of today's exam, we'll defer the genital exam and the rectal exam.
Okay.
And then I would check your lymph nodes in your inguinal area, okay?
Okay.
So I'll help you sit down. Okay. You can go ahead and have a seat here if you'd
Okay.
like. Looking at your lab work, it seems the urine shows a little bit of a infection in it, but also you did come back for a positive chlamydia. We do have the HIV and the syphilis testing and the gonorrhea testing pending. But the chlamydia for your urine was positive, so we can treat you for that, and luckily that is a sexually transmitted infection that can be treated.
Okay.
And it can be sexually transmitted through vaginal, oral, or anal sex, okay? So what's important is that you share this with your girlfriend that's pregnant, because she will need to get treated. It's really important that she gets treated, because she can transfer this disease to her child during when she gives birth. And that would be a terrible tragedy. And then the other thing is it can really be severe for women, especially because it can permanently damage their reproductive system. So lots of ways to avoid getting a sexually transmitted infection like this in the future is to always use protection. You know, it's just got to be safe, you know. And then the other thing is, you know, just to have one monogamous partner, you know, for a long period of time, because that can help you avoid getting sexually transmitted infections in the future. You know, something like this, it can also come back, so you have to get rechecked in 3 months.
Okay.
And but it sounds like, you know, you really should be calling these partners that you've had and let them know, because you just want to be safe, and it wouldn't be fair to anybody, and they should know, because you can get treated, but if you don't, there can be severe consequences. So the other things I just, you know, after everything we talked about that I should mention, or I wouldn't be doing my job, is the drinking. You know, you can still have fun and drink, but you can do it moderately, where you can not damage your health. 12 beers on the weekends kind of could be damaging to your health. And just always remember to never drink and drive. Call a cab. And then smoking. Smoking is, you know, it's really important that you just try to quit now and just save years of your life. It really can, by quitting now. So we can go over some more details, and I can give you some handouts on chlamydia, and then we can go over the urinary tract infection also. But do you have any questions for me right now?
I don't think so, not that I can think of.
Okay. All right. Well, thank you for coming today and sharing this, and then we can hopefully get you back on track to a healthy lifestyle here, okay?
All right, thank you.
Thank you.